Keeping an active lifestyle becomes challenging for baby boomers submerged in work and family obligations. It's not uncommon for these folks to become the stereotypical weekend warrior, trying to become more physically fit to only later feel boomeritis. Joining me now is Dr. Lee Rubin. He's an orthopedic surgeon at Waterbury Hospital. Welcome, Dr. Rubin.
Thanks very much for having me.
Let's get right to it. What is boomeritis?
What is boomeritis? Well, we have an aging population. People are getting older in the United States, and more people are turning 65 and technically becoming baby boomers at a rate of 10,000 a day for the next 20 years. So what's happening is, as people remain active and want to participate in amateur athletics, whether it's hiking and biking, golf or tennis, Zumba has become very popular. People are getting overuse injuries and conditioning injuries where their bodies are kind of giving them aches and pains. Their bones and joints hurt.
But we don't want to give that up, right? Is that what it is?
No,
People
nor
want
should
to
you.
Stay young.
Right.
And, right.
As a surgeon, I want to keep people active. We want to keep them healthy. We want to prevent the progression of those problems into more severe disease.
All right.
So our goal is to keep people on their feet, keep them in the game, so to speak, and keep them moving and get people comfortable despite these injuries.
All right. What are some of the warning signs?
So the big one that always comes up is pain. Musculoskeletal injuries and aches and pains are the #1 reason in 2011 people are going to see their doctors. And so if you have an ache or pain in your body that doesn't go away, it doesn't respond to anti-inflammatories that you're taking from the medicine cabinet, and it's bothering you at work, or it's bothering you when you try to do the activity you want to do, like golf or tennis in the summer, talk to someone. Talk to your doctor.
Because there's something there for them. Is that what you're saying?
Right. I mean, there's a lot of things that we can do to keep people moving. A lot of people are scared of going to the surgeon. They fear surgery. But the truth is, the best surgeons are the ones who can get you better, sometimes without the need for surgery. So we keep people moving. We want to relieve those pains, relieve the aches, and get people back to their activity.
We are seeing a lot, the patients a lot younger,
right,
who are seeking hip replacements,
right,
knee surgeries. Is that because of boomeritis?
I think that's a big part of it.
Or weekend warriors?
Extreme athletics,
yes,
you know, prolonged competitive athletics. We see a lot of people in their 40s and 50s now who are playing in sports leagues. People are doing things with their high school age kids, you know, and there's a sort of a split. In your mind, you're thinking that, okay, I'm still 22.
Exactly.
But your body is saying, I'm 45, and there's a big difference. And the surgeon often is the one resolving that difference in the office to say, you know, you have to manage the expectations of people who want to keep playing at the same level in their mind as they remember from their own youth versus what their body is capable of.
Okay, so what should you do? How do you manage that? Because you do want to stay active,
right,
but your body's saying,
right,
not quite the way you used to.
Right, it's a lot of common sense. You want to maintain excellent overall body conditioning. Keep your body in shape, not just in the summertime, but work out all year round. Go for walks. If you have a dog, walk your dog twice a day. That's a great way to get 30 minutes of exercise. It's an easy way. You know, we want people to do weight training a little bit, light weights, nothing too heavy, not to overdo it. But overall, low-impact aerobic exercise like walking, elliptical machines, swimming, bicycling, those are great activities. You combine that with some resistance exercise or light weights or yoga for balance, and overall, that leads to a lifelong health of conditioning your body. That's the best way to prevent these injuries.
You really need to listen to your body.
Right. When there's a problem, you should recognize it, try to make it better, change what you're doing. If there's one activity that's bothering you, I have a memorable patient who is a retired police officer, and he was doing explosive plyometric heavy weightlifting. And he's 65 years old, and he said, Doc, it only hurts when I lift these big weights, these kettlebells.
Only?
I said, it doesn't hurt when you're doing aerobic jogging or jump roping or push-up. No, only the kettlebell. I said, stop using the kettlebell.
Exactly.
Simple change, but then he can continue on his activities.
All right, so when should people call the doctor? You mentioned it earlier.
Right, pain is the big one. I always find people come in when the pain is bothering them at night, when they go to sleep, or when it's keeping them up at night and waking them from sleep. Those are symptoms of nocturnal inflammation, nighttime irritation that should be addressed with your surgeon to talk about ways to alleviate that.
Also, something you were talking about earlier, osteoporosis. You're seeing that more and more now in younger folks.
Almost 50% of patients over age 65 who are female will experience a fracture related to osteoporosis in their lifetime. 25% of men will too. So bone health is really crucial. I brought in just a sample just to remind everybody that we're talking about bone health in the context of boomeritis. You want to think about calcium intake. You want to think about getting the right amount of calcium, but what's really important now with the scientific data that we have is vitamin D intake. People should really get close to 1,000 to 2,000 units of vitamin D a day. whereas the older recommendation were much lower than that. So now we're recommending routinely that people get closer to 2,000 from food like milk or orange juice or supplements.
But can't you just get that vitamin D from somewhere else, too?
Well, you could fly to Florida,
Exactly.
lay out
That's
in
what
the
I was
sun.
thinking, out in the sun, being outdoors.
You need to be exposed to bright sunlight for 2 to 3 hours at the midpoint of the day. The problem in the Northeast,
yes.
we don't get out much. It's raining or it's cloudy. We wear long sleeves. We wear sunscreen and hats. We just don't get sun exposure the way we should, or perhaps we did many, many years ago when we were farming out in the fields, so to speak, all of us. So people can get it from the sun, but in this area, there is a chronic deficiency of vitamin D in most patients. Healthy patients otherwise. So we routinely recommend vitamin D, and it's very crucial for overall bone health.
Just really quickly, though, we're running out of time. Bone health, you can do something about it, even though you haven't been doing it earlier in your life.
Absolutely. So start with the calcium and vitamin D. If you're not sure, talk to your doctor. Get out there, do weight-bearing exercise, walking, even some light jogging. Those are great things to stimulate development of new bone. And also, the most important thing is to prevent injuries. You don't want to fall, so maintain good balance, muscular strength. Don't fall, don't break the bone. We can fix it, but we want to prevent it.
All right, if you want to get in touch with Dr. Rubin at Waterbury Hospital, you can call 203-573-6000 or check out waterburyhospital.org. Dr. Rubin, great advice, and thank you so much for enlightening us on boomeritis.
Much appreciated. Oh, wonderful. Thank you very much for having me.